So, hello everyone, good evening for joining in. So, I'll start with a brief introduction of the speaker, Dr. Parul, today here with us. She's an infection control diseases fellow, assistant professor, and academic researcher in the Department of Infectious Diseases at the All India Institute of Medical Sciences, New Delhi, India. She is an MD in internal medicine and holds a doctorate in medicine in infectious diseases. She expertises in infectious diseases with research contributions in COVID-19, tuberculosis, and microbiology. She has worked and has affiliations with AIIMS New Delhi and Lady Hardinge Medical College. Ma'am, I welcome you to the Global Health and Quality Alliance Wednesday webinar series, and floor is all yours.
Thank you so much, Dr. Weber. I'm presently working at Harlem Hospital in New York, and AIMS being my alma mater, whom I would also like to thank at the outset because that's where I started learning about Nipah virus, and my faculty and colleagues at AIMS were instrumental in helping me uh, learn about the previous outbreak and explore more about Nipah virus, and that's where we wrote this paper. And a very special thanks to my faculty at AIMS, all my friends, especially Dr. Shayantan Banerjee, who has been major instrumental in 2026 outbreak in India. And I'm taking the liberty to use the information which he shared, giving us the initial glimpse before it was officially confirmed as an outbreak. So thank you, Dr. Shayantan, and all my other friends for helping me out. And now that we are talking about an outbreak in a small part of the world, I also saw a very interesting site, and thanks to Amy and GHQA, that we have this live app called Outbreak Now, which kind of is a very interactive platform where you can see the numbers of rising outbreak, and I found it very useful uh, and that's why I just put it here. So now moving on to Nipah outbreak. It was initially planning to put it into the escape rooms and then try to solve a mystery, but let's change the scenarios a little bit because I understand there's a diverse audience. So let me start with something very, very basic. So Nipah is a virus which can cause encephalitis and ARDS. Just to make it clear, encephalitis means a brain infection. An infection of brain is what we term as encephalitis. I would be using this term. And the other term which I might be using is acute respiratory distress syndrome, which basically shows an advanced form of respiratory distress. And let's move on with this very tweak. So this is a case one where a worker who works in farmhand, she works in rural parts of eastern India. She presented with fever, cough, and respiratory distress. She was admitted in a local hospital, and because of the respiratory distress which kept on worsening, she required intubation. Few days later, the nurse who helped in intubation, which is the case 2, had altered sensorium, and she was admitted in the ICU of the hospital with severe encephalitis. This nurse died later, and the case 3 was a nurse who took care of this case 2 nurse. With putting all these 3 mysterious cases, which kind of give a glimpse of what happened in the previous outbreak, whom do you think is an zero case? How do you think the virus could have spread? What we could do to contain it? So just give your guesses. I'm not expecting an answer, but which of the following could be the possible source of this virus transfer? Could it be the fruits, the coconut, the dates? Could it be the hen and the eggs? Could it be the pigs? Could it be the bat, human to human, or cats? Any guesses?
The
Okay,
bats,
moving
ma'am.
on. Yeah, perfect.
The bats.
Perfect. That's a very, very, very important thing to know, that bats could possibly transfer it. There have also been cases of this being transferred through date palm sap, pigs, bats, human to human. There have been no reported cases with pets, hens, eggs, or other farm animals. And it's a very unique and intriguing virus. As we unfold the story, we'll come to that. So we're talking about this in the light of the Nipah virus outbreak in West Bengal, where 2 cases were confirmed. Both the cases were healthcare workers in the same district hospital, and fortunately, this outbreak has now been controlled. Nipah virus is a zoonotic pathogen. That means it is spread through it stays in animal host and can spread through it. It is an RNA virus. And going a little deep in microbiology, it is from Paramyxoviridae family of viruses. The first case of Nipah virus was in 1998 in Malaysia. So it's a relatively new virus. And that happened in pig farms, where the illness was initially thought to be Japanese encephalitis, because that's a very high endemic area of Japanese encephalitis. So a lot of people there were having illnesses in the form of altered sensorium, and they thought it was a Japanese encephalitis virus. A total of 265 cases were identified with more than 100 deaths. Mode of transmission was later found to be infected pigs and human to human transmission. Going on to the fact that they initially thought it was a Japanese encephalitis virus. Uh, so this was in Malaysia in 1998 and February 1999, with 3 clusters being found there. But when they thought it was Japanese encephalitis, something was not right, because most of these patients were adults, while Japanese encephalitis is more in children. There was clustering of symptomatic cases in the members of same household, like father, brother, the other co-workers, which is not so typical of Japanese encephalitis. And many of them had even got vaccines of JE. And vaccine is pretty efficacious. And despite that, the outbreak was going. And that's when they saw that in the same area, there were a lot of sick animals. There were barking, coughs, and pigs who had a very strange kind of cough, and the pigs were dying. And a big investigation went on, and from that they found that these pigs were the amplifier host, and Nipah virus was found for the first time in 1998, and that outbreak was later controlled in 1999. So Malaysia, Southeast Asia was a region where this outbreak was first kind of identified. And that's also where the name Nipah comes. Nipah River Valley is the place where it was first identified. So Nipah comes from the place of its origin. And it was first detected in the CSF, and pig cullings and a lot of animal measures kind of stopped this outbreak. After that, for a couple of years, we did not hear about this outbreak. But during this time, scientists were still trying to find out more about this. And they found in the Southeast Asia belt, which is right here, there were a lot of bats who were carrying this virus. These bats were not sick. They were just the carriers of virus. So these fruit bats are found in this area with northern Australia, Southeast Asia, parts of India, Bangladesh. And all this while, there have been sporadic outbreaks from 2001 to the recent outbreak in Bangladesh and India. The one being in Siliguri and one in Nadia in 2007 being very important because of the very high mortality rates they had. So this is the map which shows it. I'll tell about the 2007 outbreak from EID article, which says it had 5 cases and all of them died. So at this time, we're at a stage where we know Nipah virus exists. It can cause encephalitis, and it possibly is caused by pigs, because there was a pig and animal farms as based on our previous experience. But what we found new in these 2000 outbreaks was there was an index case that the man who was the first diagnosed, he was addicted to liquor of date palm sap. It was also initially thought to be something like alcoholic encephalitis, because patient had a lot of liquor. There was no exposure to pigs. There was no exposure to farms. And interestingly, his 4 close relatives also got contracted the same disease, same illness, and they were not the ones who were taking the liquor. The lab technician who took the sample also found, but unfortunately, all 5 of these cases died. Later, the lung tissue, CSF, urine, and CSF samples were analyzed, and all of them were found to have Nipah encephalitis and Nipah virus. So this virus is very intriguing because we have very different modes of transmission, from pigs to date palm sap to human transmission. So the virus is evolving in various waves, and so has to be our containment measures if we want to target the control of this outbreak. We need to be more aware and try to find out how the virus is evolving. There have been articles on why humans are affected. Bats have been found to be the natural reservoirs. Urine and saliva of bats is where the virus has been isolated. And interestingly, there have been a lot of climate health factors which they say are possible risk factors, like the forest fires, droughts in Indonesia, all that which caused fruiting failures in forest. And that's when those forest bats, the fruit bats, came to the pig farms. And those pigs, and that's how the spillover occurred to the animal and the zoonotic spillage, and then to humans by close contact. So it's a very close contact cycle of how human actions affect the environment and how environment affects the wildlife, and it in turns kind of affects us in the whole process. Let me show you this video of how the bats virus have been affecting. So this is a fruit bat, and 4% of these fruit bats in some studies have shown to carry Nipah virus. While the virus is asymptomatic in these bats, they can transfer it amongst each other by close contacts within themselves. But humans who have never gone close to this, who have had no contacts directly with this, still get it. And how do they get it? Let me take you to this village in the eastern India, where they have a very common practice during weddings and during traditional processes and cultural practice, that they drink date palm sap somewhere within the month of December to March. They put the date palm collections in the pot, and these bats come and lick at night, or they urinate in the sample. And later, when humans drink this date palm, they can get infected. And these humans can transfer it to other humans by saliva transfer or by sharing. And that's how the chain of transmission of Nipah virus spreads. We have had infrared measures, thermal measures, and a lot of dedicated scientists who are working on this. They have gone down to the details of mapping which bats are in which areas and which are the active bats who carry the Nipah virus and who have the antibodies. And our information of this is evolving, and it is very dynamic, and a lot of people are still working. And these kinds of maps are working out using infrared and thermal technology. Human to human transmission, as I already mentioned, has been known. Close contacts, especially from droplets, and very close contacts, especially from respiratory secretions, transmitted. It's unlikely to be transmitted from fomites. The previous outbreak which kind of drew attention was the Nipah outbreak in Kerala, where this rare so-called brain damaging virus created a big panic with Kerala at the epicenter, and it was again linked to the travel to one of these areas where the date palm was done. And unfortunately, what was very sad is this: we lost our healthcare workers during this epidemic. So what happened was, initially in a busy hospital, the protective measures were very limited, maximum to a mask, and we were not aware about what the virus was. And as more information evolved, we found out about Nipah virus, and our protective equipments improved and PPEs were used. And that's how finally the hospital to hospital transmission was stopped, along with many other measures which were taken. So that from moving on to the Kerala outbreak to the present outbreak. The most important thing about breaking the outbreak is the awareness. So Dr. Shayantan, who actually gave me a glimpse of this, got a call on January 10, 2026, that there's a nursing student, a young girl who is admitted in the hospital with acute encephalitis. The initial workup was negative. He went to the place, took a detailed history, found out, did an RT-PCR in the lab, and within 7 hours, they found Nipah virus as positive. Very immediate measures were taken at regional, state, national, and international level. Specimens were collected. It turned out to be positive for Nipah. Another patient was found to be, another healthcare worker was also found. So a cluster of Nipah virus was confirmed. And the other healthcare workers were screened, WHO was notified, government kind of came into action. And so as in this case, what did we learn? When do we suspect it? When there's an altered mentation, seizures, neurological deficit, fever with new onset respiratory distress, and a history of contact in a possible endemic area, or a travel history, as was in the case of Kerala case. Samples to be sent were throat swab, blood, urine, CSF. What tests do we do? Important thing to remember is person collecting the sample should wear PPE. And the virus isolation is done in BSL 3 or 4 labs. So if you're doing the isolation, it is BCL 4 lab. Otherwise, it is a lab, level 3 lab. So ELISA, PCR can help in diagnosing the disease. So once the outbreak was confirmed, contact tracing was done. So all contacts who have come in healthcare workers community were all traced. They were put in isolation, they were tested, their symptoms were found out, and a big measures of contact tracing, isolations, prompt measures kind of stopped the outbreak, and there were no further cases after these two cases. One of the patients has improved and is stable, although unfortunately the other was critical from the last time I heard. Healthcare and family transmission, we have learned that it can spread by droplet transmission. It is very important to protect the healthcare workers and healthcare management and all those involved in the management of the patient. ICU procedures create a risk, and we should identify clusters and isolate and test them fast so as to prevent a big outbreak. What is the clinical management? As of now, the most important mainstay of clinical management is supportive care. A good ICU care, respiratory failure management, ventilatory support, control of seizures, fluids and electrolyte balance. More or less, supportive care is the most important thing to help the patient. Infection prevention control practices to prevent the community. We do not have a definite medicine as of now. However, we have increasing evidence of drugs like ribavirin, which is showing evidence of encouraging data based on different studies being published in Lancet and other leading journals. There are other emerging therapies like remdesivir, monoclonal antibodies, favipiravir. From what I know, a lot of patients in the Kerala outbreak, the contacts were also given some of these drugs as a measure of possible preventive measures, as in controlled study environment, the results of which were encouraging. But we need more randomized controlled trials to kind of use a drug officially for FDA approval and for all the approvals to actually find an actual cure of this disease. So at this time, what we have learned from this and what is the most important takeaway message is the outbreak investigation, early detection, early clinical suspicion, informing the labs, taking the public health response measures, community measures, trying to spread the information to the community and stopping the misinformation spread. And that's how we can control by the rapid containment model. Like the West Bengal outbreak, if it was not timely diagnosed and if appropriate measures were not taken, it could have gone to bigger measures. But we were efficiently able to restrict it to a smaller number. So what we learned was surveillance and rapid detection is important. Flexible response and contact tracing by the regional authorities and the national teams is very important. Spreading communication, strengthening global health security remains an important thing in our time. And this has to be a global effort where everyone is working on research of possible transmission, trying to find ways to prevent and cure the disease. So what is the present and future risk in the landscape? Habitat disruption, climate change, climate variability, urbanization, global mobility, travel surveillance, role of AI, research and management, building better infrastructure for health and public health, global health collaborations like GHQA can all help us be better prepared, and this preparedness determines the outcome. And it needs to be an integrated effort of climate specialists, AI specialists, global health, doctors, microbiologists, researchers, veterinaries, public health management, and everyone who is involved in the community can have a role to play. While we are battling with these diseases, there are many other diseases which can be spread by bats, and bat watch remains another interesting part which cannot be forgotten when we are talking about infectious disease outbreaks. So that's all from my side as of now, and would be happy to take any questions. Any questions, any doubts, anything you want to discuss?
Yeah, Dr. Parul, thank you very much for this wonderful presentation webinar on Nipah virus. And Yeah, so at the GHQA, remember when we're still working on the Outbreak Now platform. Um, yeah, so we've been receiving a lot of signals or alerts about the disease, and as the chair at the GHQA, one of my responsibilities was to share the information with our members in India, so that they can be proactive and also share with the communities. And that's even the purpose of Outbreak Now, is to make sure that our members and anyone around the world who has access to this wonderful tool, they can, have the information and learn about the disease and see how they can prevent the spread of, any outbreak. And thank you very much for mentioning Outbreak Now. And this was really great presentation. And thank you again for your time. Yeah,
Thank you so
thank
much.
you.
And it's indeed a great tool, and I hope you all can use it to
Yeah.
prevent further outbreaks. And I see John there. Thank you. Hi. Hope you're doing good.
Thank you, ma'am.
Thank you so much. Thank you. For any
If
doubt,
anyone has any questions,
yeah, I'll also leave my email in the chat. You can message me, text me, or ask me about any doubts or any questions related to this. And I know today is Holi, so wishing everyone a beautiful day with, for those who are not aware, Holi is a festival of colors where we spread colors and hope for joy, happiness, and peace of everyone. So I think on this note, I would say happy Holi to everyone, wishing a colorful day, and thank you for joining.
thank you, ma'am.